So the first is my impression, having been a transplant clinician for a long time, or when I meet patients and their families and I talk to them and I see them in an office visit and we're chatting either officially in an office visit or in other settings, what are the three things that kind of pop into my own mind? And ironically, I made this slide and then I did peek at some of our panelists, and I think the themes are going to overlap. So how cool did that turn out to be? But the first was adherence, and that is, making sure that you take all your medications as prescribed. Also being adherent to lifestyle, meaning diet and exercise, but also, as Jim hinted at, cancer risk reduction, wearing that sunscreen, getting those colonoscopies, being careful about exposures to things that could increase your risk. The second thing is communication, meaning being a partner in your care. I would argue being an advocate for your own care, meaning that you're going to call when you're not feeling well. If you're confronted with a challenge, your insurance is changing, the copay for the meds are too high, you're moving to a new city, you have a change in your life or your lifestyle, you have grandkids moving in with you or kids moving out, there's some challenge that's going to impact your care, that you communicate with us so that we can leverage the resources we have in the transplant programs to kind of help you. And then to also call with questions, is it safe for me to do this? Can I travel to Wuhan, China next week? Those kinds of things where we might be able to offer, hopefully, some reasonable advice in terms of just knowing how we can guide you in terms of reducing risk and kind of preparing for the best. And then the last, I would argue, is kind of my spiritual side, but that is the patients that have been the most successful in my experience, they have purpose. I used to call it structure, and I changed it to purpose. And when I used to have a slide that said structure, what I meant was the people that returned to work quickly and really had a structure in their life or a rhythm in their life seemed to do better. But it's actually not truly about structure. As I've gotten older, I think it's more about purpose. It's having something to do, whether that's engaging with your family, engaging with your community, be that your church community, or whether it's a community activity, or whether you're volunteering within transplant, or whatever it is that makes you excited, or returning to your career, or for some of our patients, finding a new career, or volunteering, but having some purpose, some place in your world that kind of gives you structure. Because people that have purpose, they find ways of taking care of themselves. They recognize the importance of kind of being there for others. They have some higher need, and that engages them. And therefore, they're more likely to follow the lifestyle things. They're more likely to do the things that are necessary to keep them healthy. If I can just show my second slide, and then we'll kick it off with the panelists. My second slide is the slide that talks a little bit about, what are the long-term risks that people have. So the first, you heard a little bit about this, are immunosuppression medications can increase your risk for certain medical problems. So, we worry about secondary cancers as being one of the things, but obviously infections and kidney troubles and other things that immunosuppression medicines can cause. So that's one long-term issue. The second is that pre-existing medical problems still exist. So people who say get a heart transplant because they have coronary disease, we still need to treat the rest of the blood vessels in their body, even though we gave them a new heart with new blood vessels. If you had diabetes, for instance, maybe absent the pancreas transplant, the diabetes is still going to be there. If you had high cholesterol, that's still going to be there. So we still need to manage those things over time. Your family history still matters. So if there's a family history of breast cancer or skin cancer or colon cancer, that may change your risk. And therefore, even though you're a transplant recipient, knowing and engaging in your family and understanding your family history really does still matter. And lastly, I always say this at our transplant meeting when people are surprised, but our patients are allowed to get the same stuff that everybody else gets. So our patients will develop some of the same chronic diseases as they get older that they would have gotten had they not been a transplant recipient. So we can't forget about cancer screening like prostate cancer and those kinds of things, because they could have gotten those things if they lived long enough anyway. And so we want to make sure that we're thinking about good primary care, good routine medical care over time.